Bismillahirrahmanirrahim. Hello friends, today we will discuss about the coronary artery diseases. Coronary artery disease. A narrowing of the coronary arteries that prevent adequate blood supply to the heart muscles is called coronary artery disease. Usually caused by atherosclerosis, it may progress to the point where heart muscle is damaged due to the lack of the blood supply. Such damage may result in infarction, arrhythmias, and heart failure. Coronary artery disease is also known as atherosclerotic heart disease, coronary atherosclerosis, coronary arteriosclerosis, coronary heart disease, coronary atherosclerosis. Coronary atherosclerosis is the abnormal accumulation of lipid or fatty substances or fatty erythromas plaque, which is also known as plaque, in the lumen of coronary arteries. Acute coronary syndromes. AC, ACS is a term used to define potential complication of CAD. These syndromes include unstable angina, myocardial infarction, ST segment elevations, also known as ST elevation, myocardial infarctions, non-ST segment elevation. Risk factors. We have two risk factors in these diseases. One is modifiable and one is non-modifiable. As name suggested, non-modifiable risk factors are that which runs from the families, like in their genetics, in their chromosomes, and modifiable risk factors are given. Modifiable risk factors are high blood glucose level, cigarette smoking, tobacco use, hypertension, diabetes mellitus, lack of estrogen in women, physical activities, obesity. Non-modifiables: family history of CAD, increasing age, genders. Most males have these diseases. Races, non-white populations are at high risk. Pathophysiology of coronary artery diseases. Due to etiological factor, injury to the endothelial cells that lining the arteries, inflammation and immune reaction occur at the lumens of the coronary artery, accumulation of lipids in the intima of arterial walls, T lymphocytes and monocytes that become as the macrophages infiltrate the area to ingest the lipid and die, proliferation of smooth muscle cells within the vessels, formation of fibrous cap over death, fatty cords, erythroma, protrusions of erythroma into the lumen of vessels which occlude the calibers of the lumen of coronary arteries, narrowing and obstruction occur. If cap is thin, the lipid core may grow, causing it to rupture, hemorrhage into plaque, allowing thrombus to develop. Thrombus and obstruct the blood flow, leading to the sudden cardiac death of myocardial infarctions. Angina and other symptoms also occur. Sign and symptoms: chest pain, angina pectoris, myocardial infarctions, diaphoresis, ECG changes, dysarrhythmias, chest heaviness, dyspnea, fatigue. Diagnosis: history collection, physical examination, cardiac enzymes, electrocardiogram diagram, echocardiogram, stress test, nuclear imaging, angiography. Electrocardiogram, ECG or EKS. GS provide a record of the heart electrical activity. These simple tests record any abnormal finding in the heart electrical impulses. Electrodes are placed on the arm and chest to monitor electrical activities. ECG changes occur. Echocardiogram. It is may be ordered if doctors suspect a problem with the heart muscles or one of the valves that channel blood through the heart. Stress test. They, they are used to show how the heart react to the physical exertion. Exercise stress tests are usually performed on the treadmills or exercise bicycles. Nuclear cardiac imaging involves the use of a small amount of short-lived radioactive material which is injected in the bloodstream. A special camera live motion X-rays detect the radioactivity of those material, and the image display show how heart pump blood. This is useful in identifying any area of abnormal motion or for assessing the blood supply to the heart muscles. Angiography is the most accurate means by which they examine the coronary arteries. It requires a surgical procedure called cardiac catheterizations. During the procedure, catheters, a small thin plastic tube, are placed in the artery of the leg or arm and directed using an X-ray machine to the opening of each coronary arteries. Complication: chest pain, heart attack, heart failure, abnormal heart rhythms can occur. Management: pharmacological therapy, anti-anginal medications like nitrates, beta-adrenergic blockers, calcium channel blockers, acid inhibitors, statin, imipramine for analgesia. Surgical interventions like angioplasty, stents, coronary artery bypass, grafting, PTCA. PCI, also known as angiography, coronary artery bypass grafting, PTCA. Lifestyle changes. Lifestyle changes that may be useful in coronary artery disease include weight control, smoking cessations, exercise, healthy diet. Nursing, nursing management assessment. Gather information about patient symptoms and activities in PQRS formats. Assess patient risk factor for CAD. Assess patient family understanding about diagnosis. Identify patient and family level of anxiety and use appropriate coping machine. Obtain and assess ECG, vital sign and reports for or of LDL level. Evaluate patient medical history for such conditions such as diabetes, heart failure, previous MI, obstructive lung disease that may influence choice of drug therapy. Nursing diagnosis: acute pain related to imbalance to oxygen supply demand, decreased cardiac output related to reduced preload afterload contractility and heart rate secondary to hemodynamic effect of the drug therapy, anxiety related to the chest pain, uncertain prognosis and treating threatening environment. Thank you very much.